What are uterine fibroids? This is actually a really common gynecologic phenomenon or complaint. They are completely benign growths in the uterus. They can be completely asymptomatic, or they can cause problems for a lot of reproductive age women. Now, fibroids can be really big, like this one here, or they can be very, very small. They can be on top, they can be in the muscle, or they can be kind of in the inside or in the cavity of the uterus, or they can be kind of hanging off, okay? Now, sometimes a very small fibroid can cause all kinds of problems, and a very big fibroid will cause no problems. It honestly really depends on the patient. So the treatment options for these, if they are symptomatic, which the symptoms you would see would be heavy bleeding, very painful bleeding, prolonged bleeding, passing large amounts of clots, a lot of pelvic pressure, and pelvic pain. And sometimes, depending on where the fibroids are, it could affect your ability to empty your bladder. It could affect your ability to have normal bowel movements, depending on how big they are and what they're kind of pushing on in the pelvis. So the treatments for all of these things, there's a couple different things. You can do it completely non-invasively with hormonal treatments. Typically, hormonal treatments would be either birth control pills or a hormone-containing IUD that can help to shrink the fibroids, or to at least keep the bleeding from the fibroids under control. Other options for the fibroid would be a fibroid embolization, which is done with a interventional radiologist. They inject medication through a vein, they find the blood supply to that fibroid, they put medication there, and they cut off the blood supply to the fibroid, and what will happen is that that fibroid will start to shrink. In some cases, you might be able to get away with doing an endometrial ablation to treat the uterine fibroids if that is the issue. Sometimes that's successful and sometimes that's not. The ablation is basically burning the lining of the uterus so that when you have your menstrual cycle, not a lot of tissue can build up, therefore you don't have a heavier flow. The definitive treatment for fibroids is, of course, a hysterectomy. If you're not ready to be done with all of your childbearing, but you have a large fibroid that could be causing you issues, another option would be to get a myomectomy, which is essentially just removing that fibroid off of the uterus. This is really reserved for people who are still planning on having children. If you're done with your childbearing, that's not necessarily the best option for you in terms of treatments. But those are usually the common treatments that you would do. For people who are symptomatic, again, it's abnormal bleeding, heavy bleeding, painful periods, frequency, and pelvic pressure are the common things that you will see.